I'm Dr. Betty Robin. I'm an attorney, a dentist, and a practice cell broker in Orange County, California. This series, Dr. Robin's Straight Talk, is my opinion on questions or issues I'm commonly asked about. I've formed my opinions after 25 years in the practice transition field as an attorney and broker, and about 10 years before that as a practicing dentist. That, along with my dad's so-called horse sense, has allowed me to assist many doctors with their practices. I know there are exceptions to everything, but I'm going to be talking the norm here. If you have questions you want me to address in this podcast forum, you're welcome to email me at drrobin@bettyrobin.com. And if you don't agree with me, you can email me that too. So let's get going with Dr. Robin's Straight Talk. Today we're going to be talking about clarity. Obviously that's not a new concept, but it is a very important concept. If you told me you were going to buy a new car, and I asked you what kind of car, I'd bet you'd be very clear. You'd tell me what model, what year, what color, and you'd probably even tell me all the options you want on it. There'd be no ambivalence in what you wanted. So why, when you're making probably the biggest purchase of your life, do you not know exactly what you want in a dental practice? In this episode of Straight Talk, I want to help you get clear, at least as clear as you are when buying a car. If you aren't clear, it's hard to recognize that practice when you see it, and it's hard for brokers to really help you. So you call me and you say, Betty, I really don't know what I want or where I want it. I just hate my associate job and I need to make more money. I'm renting an apartment, so it really doesn't matter where I move. Well, at least I have some clue. You say you need to make more money. What are you making now? For example, let's say you tell me you're making $120,000 a year. So how much does a practice need to be collecting for you to make that much? In general, and yes, I know there are a lot of variables, you need to only look at practices collecting 5 times what you want to make. 5 times will give you a pretty accurate number after factoring in debt. So if you want to replace your current income of $120,000 a year, you need to look at practices collecting $600,000 a year or more. If you want to make more, let's say you want to take home $200,000 a year, then you only need to look at practices collecting at least $1 million a year. So don't waste your time looking at smaller practices, unless money isn't the goal, but who is that true for? Now we've nailed down the collections of the practice you should be looking for. Let's narrow down whether you want a shopping center or a professional building. Most of you do have an opinion on this. In fact, I can't even remember the last time I talked to someone who didn't have an opinion on a shopping center versus professional building. There are pros and cons to both, and we're not going to go over that now, but most of you do know what you want. So let's say, as way of an example, we now know you want to make $200,000 a year and you like shopping centers. So we're looking for a practice doing $1 million or more in a shopping center. Now we're getting somewhere. Another thing most of you have an opinion on, especially after associating, is whether you want a practice that accepts Denti-Cal, HMOs, PPOs, or is only private. Again, there are pros and cons to all combinations of insurances, and all of them work for different doctors. But they may depend on your beliefs and your goals. Whatever it is, you also know the answer to that question. So now we have, you want to practice collecting at least $1 million a year in a shopping center doing primarily PPOs, as way of example only. But you are much clearer than where you started, and I think we can keep going. For those of you who tell me you don't know where you want to be, is that really true? Can you at least narrow it down to a few counties? I mean, do you prefer LA or Orange County? Or Riverside or San Bernardino County? Or San Diego County or Ventura County? What do you prefer? Probably different kinds of people and different kinds of lifestyles like different things. So who are you? What do you really want? Now, I really don't think any of you should live much more than 10 miles away from your practice, especially if it is your first practice. Commuting sucks, traffic's horrible, and you need to be really involved with your first practice. I actually could see my first office from my apartment, so it was never out of my mind, and I think that was a very good thing. It was also never a hassle to go and do anything at my office on off hours. I say the closer the better. Yep, and I know there are a lot of other things to consider, and I want you to stay on this track and really try to keep narrowing your list. Remember, you hold all the cards. You're the buyer. Just like at a car dealership, you can look or you can walk away. But if you narrow down what you want, it certainly helps your looking process. So try to get as clear as you are with your next new car, and be ready to pounce on that practice when it becomes available. I really hope this helps. Thank you so much for listening, and I really do hope this was helpful and I can find even better ways to help you. If you like what you've heard, please subscribe on iTunes or Stitchers. Thanks.